Good afternoon. Welcome to SUNY Downstate. Welcome to our first annual, what we hope to be an annual event, Brooklyn Research Update on Alzheimer's disease. And we're very excited to have you all here today. We're here today to talk about the ongoing research efforts to combat the growing crisis in Alzheimer's disease and related dementias. Alzheimer's disease is one of the fastest growing illnesses in our country, and it's touched many of the people here in this room already. I'd imagine it touched me and my family. My own grandfather had vascular dementia, and I learned firsthand how difficult this is for my own family, and I've then gone on to be here at SUNY Downstate, the Associate Director for the Center of Excellence for Alzheimer's Disease, where we've, alongside the great leadership of our director, Carl Cohen, come to be one of the New York State Department of Health funded Centers of Excellence for Alzheimer's Disease, where we serve families each and every day. So I'm going to leave the discussion of Alzheimer's disease and the public health crisis that we're facing to our brilliant panels of speakers that we've invited today. But I want to take just a quick second to thank all of the co-sponsors of this event, without which it would not have been possible. That includes the New York Memory Center. If you're here in the audience, just wave your hands so everyone can know who we are. Thank you so much. These folks put in a tremendous amount of effort in making sure this event happened, and we're very grateful. The Alzheimer's Association New York City chapter, who also put in a tremendous amount of effort. If we could wave our hands. These folks are doing great work around the city, and we're proud to be their partner today. Sunnyside Community Services, one of our partners here at Downstate, and who's also engaged in one of the Caregiver Support Initiative grants around New York City. Are we here? Maybe we're still outside at the table. And also, Sunnyside Community Services. Thank you very much. And the Brooklyn Borough President's Office, who we're very grateful for their co-sponsorship. And we're going to invite them up for just a second to introduce and speak.
So I think Dr. Reinhardt said it right, that we're in a public health crisis, and no one has taken that as close to heart as the borough president. My name is Rachel Atchison. I'm his deputy strategist. I work on all things healthy eating and specifically on plant-based nutrition. For those who don't know his story, the abbreviated version is he was suffering with severe type 2 diabetes, and at the time he was so far in that he was blind in his left eye, had tingling in his fingers and toes, and then he started to learn about a plant-based diet. And with that diet, really totally reversed his conditions. And so from that, with the reversal of his diabetes, he helped his mom get there, so the reversal of her diabetes as well. From there, he has now become such a staunch advocate for public health. And actually, we were at SUNY Downstate a couple weeks ago speaking at the first plant-based conference. So definitely SUNY Downstate is a leader in this field of public health and of Brooklyn public health. So the borough president has asked that I cede the floor to Dr. Beth Helsner. She's on faculty here at the School of Public Health, and she'd like to say a few words about how diet really impacts Alzheimer's. So thank you so much, Dr. Reinhardt, and continue with your great work.
Hi, everybody. Thanks for having me. I'm just going to speak very briefly. As Rachel said, we have an ongoing partnership now with the Borough President's Office when it comes to initiatives around plant-based nutrition, and it's something that I've become very passionate and interested in over the last several years. So the interaction between diet and Alzheimer's disease first really got on my radar when I was working at Columbia on the Washington Heights Inwood Columbia Aging Project. And one of the researchers there, Dr. Nick Skarmaeus, did a series of studies looking at the association between the Mediterranean diet profile and Alzheimer's disease. And for those of you who don't know, you probably all know, but the Mediterranean diet is characterized by a high intake of vegetables, legumes, fruits, nuts, cereals, and fish, and low intake of red meat, dairy products, and saturated fat, and it also includes moderate alcohol intake. So I'm going to talk to you about a couple of different studies they did. The first one looked at the incidence of Alzheimer's disease. So starting with a disease-free population, they characterized each person in terms of how adherent they were to the Mediterranean diet and separated the group into tertiles. And the people who were most adherent compared to the people who were least adherent had about a 40% lower incidence of Alzheimer's disease over 10 years of follow-up, which is pretty significant. They also then looked at survival after diagnosis of Alzheimer's disease and found that the people in the highest tertile of adherence compared to the lowest were at 73% lower risk of early death, and in fact actually lived an average of about 4 years longer. And then the last study that they looked at was looking at the development of mild cognitive impairment. And they found that over 10 years of follow-up, the people in the highest tertile of adherence compared to lowest were at 28% lower risk of developing MCI. And then finally, looking at people with MCI, looking at conversion into Alzheimer's disease, people in the highest tertile of Mediterranean diet compliance were at 48% lower risk of incident AD. So a very strong relationship, protective relationship between Mediterranean diet and Alzheimer's disease. More recently, there's been a focus on a dietary pattern called the MIND diet, which is a hybrid diet between the Mediterranean diet and the DASH diet, which is the dietary approaches for stopping hypertension. Again, this diet focuses on green leafy vegetable consumption, overall vegetable consumption, whole grains, fruits, nuts, olive oils, wine. This diet also includes a little bit of poultry, but avoids, again, butter, margarine, cheese, fried foods, pastries, sweets, and red meats. And they found that adherence, again, to this MIND diet was associated with a 52% decreased risk of incident AD over about 10 years of follow-up. They also looked at the DASH diet separately and found a 39% decreased risk of AD associated with the DASH diet. So the message here is that diet actually can play a very strong protective role when it comes to AD, which is good news. It seems that adherence to diets that have a focus on whole foods, especially whole plant foods, seem to be particularly effective. These are all very promising findings, and I hope that we can continue this discussion later. But that's all I'm going to say for today, and I wish you all a wonderful conference this afternoon. Thank you.
Thank you very much. We hope to incorporate that into our next conference. I also wanted to add two other thank yous that I neglected in my first introduction. Our own chair and Department of Psychiatry here at SUNY Downstate has been extraordinarily supportive, and we're very grateful for their ongoing support. And also I wanted to add our thanks to NYU, who's brought two of their faculty here today to speak, and without whom this could not have been possible.